And when was the injury again?
A month ago.
The 14th, right? 2 months now.
Yep.
April 14th, right?
Correct.
And does that hurt you there?
A little bit.
And does that hurt you there?
Yeah.
Yeah. There?
No.
There?
Yes.
There?
Yes.
Here?
No.
Achilles pain?
No.
Can I move it up and down?
Yeah.
How's that?
Hurts.
Hurts more over here?
Yes.
Yeah. Does that hurt?
Yes.
Side to side hurt?
Yes.
You know, I can't make the pain go away. With your MRI, we think this will get better with time. You just got to wait this out. You know, I don't have a great answer that could magically make it go away, other than to say that, you know, people your age who have MRIs that just show swelling get back to normal in the vast majority of cases. I mean, in 98% of the cases. So, you know, all this white, this is looking from the bottom up, all this white is some swelling in the outside part of the ankle. I mean, that's what you have. It looks like you've had an injury there, there's no doubt, but I mean, nothing here needs surgery or needs anything terribly aggressive. You know, you kind of let that heal and it resolves in the overwhelming majority of patients.
It still gets swollen. You sent me back to work and they had to take me out. My whole ankle got swollen with driving the bus.
Yeah.
And it still gets swollen.
Well,
it's 2 months later and you sent me back to full service and they still had to take me out.
Yeah, well, I mean, it may swell a little bit. It's only been two months. Some of these things can swell for a long time.
It wasn't just the swelling, it was the pain as well. I mean, a lot of pain.
Yeah, well, again, with at 2 months out, with your MRI findings, with x-ray findings and everything, I don't think you need, I think it's to your benefit to use this and get back to doing things. I don't think, you know, being not working.
Before I started working, my foot didn't hurt. After I woke, it looked like a tube was around my whole ankle after working.
And you're a bus driver?
I am, and that was only 2 hours of work.
Yeah. But again, I don't know what's specific about sitting and driving a bus makes it so bad as opposed
because
to
you have
home.
to use your foot. Your right foot is what stops the bus and accelerates the bus.
Sure, I understand.
My job is a very demanding job, and I have to brake and accelerate with this right foot, so it's of a great importance.
Yeah, I get that. I don't have a great answer for you other than to tell you, you know, if you don't do crazy stuff to this, it'll go away. If you start doing crazy stuff to it, it'll get worse. So.
No, I never did nothing crazy.
I know, you haven't yet.
Yeah, I just want proper treatment.
But there are people who do crazy stuff with it, who go and try goofy different treatments, and then they don't get better. So this doesn't need a whole lot of treatment. It's an ankle sprain. It's got inflammation. It's 2 months old. It doesn't need a whole lot of treatment.
Right. It has got worse. You sent me back and it got worse. It progressively got worse. I even videoed it and sent it to my attorney and to the job. You sent me back and it looked like a whole tube was around my ankle after 2 hours of driving. That's not acceptable, sir.
Well, you mean the swelling?
Yes, it was a whole thing around my
swelling is a normal part of healing. I know nobody likes swelling, but when you have an injury, you get swelling. If I can magically make that go away, I'd be happy to do that for you, but unfortunately I can't. So
again, you sent me back to work. I was in pain and my ankle got swollen. They had to take me right back out after 2 hours. I told you when I came to you, it was still, especially within 2 or 3 hours of driving or doing anything, it's extremely, it gets like a tube, or like you saw before, how swollen it gets.
Yeah.
And yet you still say that pain is okay. It's part of healing, and the swelling is okay.
Swelling is a normal part of an injury. That's part of a healing response.
And all this stuff is normal.
Well, pain is never normal. Swelling is not normal. It's expected when you have an injury. It's not normal. When people break their ankle, they get swelling and bruising. That's expected. That's not normal.
So you saying this whole thing, this big Lord, I can't even see my ankle. On this side, you can see an ankle. On this side, you can't see anything, and it's going all around. You're saying that's normal.
I'm not saying it's normal. I said it's expected. Swelling is never normal. Okay?
2 months into it, and
swelling
I told you when I originally
normal.
saw you, I needed better treatment because it's hurting. It hurts.
Okay.
So
swelling is never normal. Pain is never normal. They're expected after an injury, but they're not normal. So a normal foot is not swollen. It's not painful. And that's what it was before the injury, we presume. But
presume it was before the injury.
But
don't make them kind of allegations, sir.
I'm not making any allegations.
It got hurt when I got injured. It was due to the injury.
Right. But it's expected. When you tell me you have an injury, when your MRI shows some swelling, on the MRI, we expect that to translate to swelling in your foot. So when I look at your MRI and you say it's swollen, it's like, well, sure, I can see that, right?
You can
But you had an
still see
injury.
it today,
Right.
and it's 2 years later. I mean,
2
2
months
months
later,
later,
right.
and you sent me to a job for full, no restrictions.
Right.
2 hours in that, I had like a
I
tube
know you
around
said
my
that
head.
already. I got that.
Because I don't think you're comprehending
I'm
or
comprehending.
understanding my words. That you sent me into, and I got worse, and my
Okay.
foot started hurting more.
Well, you're clearly not comprehending what I'm telling you.
So what are you telling me,
I
sir?
am telling you, you've got an ankle sprain that's 2 months old. The overwhelming majority of patients with ankle sprains that are 2 months old can do everything, including sports and running and jumping.
Everybody's different.
I understand that.
them.
That's
Please
why I said
treat-
the overwhelming
please treat me-
majority, right.
Please treat me as
Right.
as an individual.
And in my
as
professional opinion, who treats a lot of these, is that you can do full duty without restrictions. That you could sit on a bus and push.
So with my ankle this swollen, and then it gets swollener as I progress and have to stop and go, and I'm telling you I'm in pain. My life and the passenger's life means nothing to you.
No, you're putting words in my
No,
mouth.
I'm just asking you
I'm just
because
telling-
you're trying to put me in a compromising
I'm
situation
saying-
if I'm in pain and my foot is getting swollen.
I'm saying I don't think you need to be on any work restrictions. If your boss doesn't want you to drive the bus, he has every right to take you off the bus. I'm not going to argue with him, whatever he
If I
wants to
drive
do.
the bus and I'm in pain and my ankle gets swollen, I'll be right back here. Because I'm going to I have a right. I got injured at work and I have a right to get properly treated for it. You still see it's swollen
Okay.
right now.
And what
But yet
what
you want
treatment
me
are
to-
you looking for? That's what I don't understand. What treatment are you looking
I
for?
would like for my feet not to be in pain,
Well, what
my foot
treatment? I
not
know-
to be in pain.
That's what
and
you want, but what treatment are you looking for?
you're a doctor.
I
What
know.
treatment is supposed to happen?
I don't think you need treatment. That's what I
So
said.
my foot wasn't swollen before I got behind the wheel of that bus, but as I got in 2 hours, my foot had a tube around it and it was throbbing. And you're saying that's what I need to do
I'm
more?
saying you don't need treatment for it. What treatment would you think you need for it? You have this
I would
idea that
think
you
it'd
need
be
some
physical
treatment.
therapy. I would think it'd be physical therapy. I would think the foot shouldn't be in pain. I would think it shouldn't be getting this swollen to this extent. But then I'm not a doctor and I didn't go to school. This is your craft. So if you're telling me pain and swollenness is okay,
Pain and swelling is expected. Now, we had you do some physical therapy, it looks like, right?
correct.
You went to 8 and you missed 4.
I did not miss anything. You stopped my treatment, sir. You took me
Okay.
off.
Well, maybe I can.
I missed no
Somebody
appointment.
canceled them. Maybe I can.
No,
I
you
don't know if I
canceled.
canceled
You took
them.
my
I don't know if I
treatment.
canceled
Right.
them.
You took me away from my treatment. I never missed an appointment.
Yeah, I don't know who canceled it. Okay?
You did. You stopped me from going.
Yeah. Well, looking at the comments from the therapist, I didn't think you need a whole lot of more treatment in physical therapy. And again, maybe I'm the one who stopped it. I don't know. But looking at this doesn't look like it needs a whole lot more treatment. Why don't we repeat the MRI if you want?
You're getting a percentage of it anyway, so because we signed to say disclaimer is part of your.
I mean, you want to do it at Barnes? I mean, I don't get anything about. I don't care where you do the MRI. You can go to Big Barnes if you want. I mean, I get nothing there. It costs insurance a whole lot more money, but do it there. I don't care. I mean, it doesn't matter to me.
I just want.
What do
treatment.
you want to do?
I want to get better. All I
Right.
see now is when I start driving, how big my ankle gets.
But again,
so that makes me think something in my body's telling me something's not okay.
I'm telling you, in my experience, this doesn't need a whole lot of more treatment. It needs just wait it out and it'll get better. Now, if you got
sent
some
me to
treatment,
work,
if
and
you
I
got some treatment that
extremely
you have
worse.
in your mind that you want, let me know what that is.
Sir, what is supposed to happen? If
Nothing.
you sent me back to work and I got extremely worse that day. That day I videoed it because just a time stamp it and sent it to my attorney.
Well, why don't we do this? Why
And
don't
my
we-
foot was swollen.
Why don't we
like
send you back
crazy.
to work and get an MRI after work that day, at the end of the day, and we
You
can
have
see
to
how
say
bad
so,
it is.
but if I don't make it through the day, I'm never doing anything in extreme pain. I'm gonna call. I don't want to see. I'm professional. I don't jeopardize other people's lives.
Well, that's good.
My
That's
idea,
good.
right? I know it's wonderful.
Right.
My idea is to do a job to the best of my ability, but I'm not gonna put
Well,
compromise.
why don't we get the
anybody's
MRI
job.
after you do a half a day of work or something? So you
I
can
don't
see
know
what
if
it
I
looks
can do
like.
that, sir. I'm going. If I'm in pain, I'm immediately getting assistance if people are on the bus, so I
Okay.
don't have to drive anybody.
Okay. Well, I mean, I'd recommend, again, I don't think the MRI is going to show a whole lot, but with your concerns, I'd get an MRI and just make sure we're not missing something. Your other MRI was 6 weeks ago, and it looks fine. And, that's what I'd recommend if you're worried about it. I don't think you really need it, but it's easy to get, and you can get it anywhere you want. If you're concerned that I make a couple bucks off the one downstairs, go wherever you like. Pick one out, we'll get you approved there. It doesn't matter to me.
Okay.
It doesn't,
Well, I definitely
go
would
wherever
like.
you like.
I would like professionalism and to be treated properly.
Okay. Well, why don't we get you set up and, wherever